I'm Dr. Anthony Maloof from Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on keratoconus, selling hope. What do I mean by that? Well, let's look at your basic keratoconic patient. They come in, they can't see, they don't know why they can't see because it's an invisible disease, hence I call them invisible cripples. And they go and see somebody who says, oh my God, you've got a problem, let's fix it. Sounds great, that's what everyone wants, that's what we are in the business of doing. The difficulty in this condition that's invisible is that you actually don't know what the problem is, you don't know how severe it is, and you actually don't know what's going to happen or what's supposed to happen. The cornea is not an intuitive concept to us. So now imagine you take that situation, you go in and a doctor says, we better treat you with X just because in the future Y might arrive. That's what I mean by selling hope. Treatment Y is not even invented. But selling you treatment X on the basis that treatment Y might arrive is selling hope. It's actually false marketing. So this is a young man, let's call him John. He's 26, he comes in. He can barely read 3 lines down the chart with his right eye. You'll see the map here. It's quite severely keratoconic. History of eye rubbing. His left eye sees 6/6, keratoconic, but he can cope with a distorted 6/6. And he came in for a second opinion because he was booked in to have cross-linking. When I asked why were you having cross-linking on such an advanced and thin cone, he said to me quite upright, I was told that I need to have it done now just so that if something happens in the future, if new technology arrives, then I can have the treatment. Otherwise I won't be able to have the treatment. Sort of got it all backwards really. In the end, what he needed to do was to know to stop rubbing and then be monitored. What he wants is he wants vision restoration, and I will undertake a stromal transplant for him, and you can view that elsewhere. You can click on the links below to understand what that does. But selling hope as a philosophy in medicine or surgery doesn't work. And to do it in this way, when somebody can't actually validate what you're saying because there is no new treatment, is not really good practice. To be kind to the person, and it also gets the nature of the condition, gets the treatment of the condition a very bad reputation. That patient will come back and complain, cross-linking did nothing, which it will do nothing for that young man. So that's what I mean, keratoconus selling hope. In this pitch situation, as I said, this young man's booked in and we will do a stromal transplant. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.